Welcome, everyone. I'm Tom Farmer, and you're listening to Health Talks. We want to share information between patients, employers, and doctors. Together, we can all make healthcare more accessible for everyone. So every Wednesday morning at 8 a.m., let's spend 6 to 8 minutes on the most talked about issue of the week. Okay, everyone. This week, it's not so much of a question as a request. And the request we're getting is for people they say, hey, Health Talks, can you translate my healthcare bill? So let's try to do that. We're going to help you understand your bill. And trust me, this is going to be a challenge. It was like reading your telephone bill in the old days. But let's start to go through this process. So when you get a healthcare bill, and I'm assuming you're talking about the statements that you guys get from your insurer, they are really difficult sometimes to understand, especially at first glance. So let's understand the components of your healthcare insurance and billing. And those components really fall around three categories. It's your deductible, your co-pays, and your co-insurance. And there's another little phrase that we'll use called your out-of-pocket maximum. And I'll come back to that in just a minute. But first of all, let's talk about the deductible. So the deductible is, and we've talked about this before, but think of it like the deductible on your car insurance. So if you have a $1,000 deductible on your car insurance, that means whatever happens, whether you bump it or total it or whatever happens, you're going to pay that first $1,000. So the same thing is true in your health insurance. Your deductible is what you pay first dollar. So if you have a $3,000, $4,000 deductible, when you go get a procedure or you get something done, that first $3,000 is on you. So you're going to pay that. A copay is generally used with something like a prescription drug, medicine. So when you go to the pharmacist and you're picking up your drugs, they tell you, okay, that'll be $10 or that'll be $30. And the reason they do that is because that copay is the way they do drugs. They just say, instead of a percentage, usually, it depends on your insurance, but instead of a percentage, they just say, okay, well, the copay is, X number of dollars. So a copay is a flat dollar amount that's used for something like we just described, like the drugs. You might have a copay for a emergency room visit or something like that, where they give you sort of a flat dollar amount for a certain event or product. Co-insurance is different because instead of a flat payment or flat fee, it is a percentage. So for example, you might have a co-insurance of, say, 30%. And so that way, let's say you have let's now stack it all together. So let's say you have an $8,000 deductible and you have a 30% co-insurance and a $15,000 maximum out of pocket. This is probably for a single person, by the way. But anyway, let's follow that. So let's say you have a shoulder arthroscopy and it's a $12,000 procedure. Well, actually, that's if you were paying cash, direct pay. Let's say it's $20,000. So it's a $20,000 insurance procedure. So on this $20,000 insurance procedure, you've got an $8,000 deductible. So right up front you're paying $8,000. Then you've got co-insurance of 30%. So you already paid 8 of the 20. So that means there's 12,000 left that the insurance company is now going to kick in and pay. However, wait just a second, you've got a 30% co-insurance. So that means they want you to share 30% of that balance. So 30% of that $12,000 balance is $3,600. So you got $3,600 plus the $8,000. So now you're paying, what is that? 36 plus 8, that's $11,600. So you're paying $11,600 out of pocket. Now, we haven't added anything else in, but let's say you're there. Well, let's say we put on a crazy out of pocket, but let's say your maximum out of pocket is, just for kicks, we'll say $11,000. If it's $11,000, then that means anything above $11,000, you don't have to pay because you've hit the maximum that you're going to pay out of your pocket. So that's how all of these things kind of blend in to get to the point of what you're going to have to pay in total. So when you have an insurance policy, a health insurance policy, and you have a deductible where it's different from an automobile policy, is the deductible on your automobile policy, that's it. No more. It's your deductible and you're done. On a health insurance policy, the deductible that's the tip of the iceberg. I mean, you just started. So that's why you want to find out what's the maximum out of pocket on my health insurance policy. So you should look at your health insurance policy and you should find out what's my deductible, what's my co-insurance, if any, and what's my maximum out of pocket. Those are the three most important items. Co-pays are kind of important, but they're sort of marginal compared to the other. So once you look at those things, then you can kind of translate your healthcare bill. And you'll see what'll happen is when you get your bill, there's usually some crazy number, like you basically, had somebody look at your arm and they did an MRI and they checked it and they did something else. And like me, which happened on my knee, there's some $15,000 bill just for diagnostics. But then I had one of the big insurers, I won't name names, but I had one of the big PPO insurers. And so that $15,000 bill, lo and behold, they gave me this wonderful discount of 60%. So the $15,000 bill, boom, they took off, whatever that is, $9,000 of that. And now my bill is $6,000, which I had to pay out of pocket. By the way, those numbers aren't exactly right because I paid about $8,000 out of pocket. I think it was 18,000 or something. I don't remember the numbers. I do remember the out of pocket. Anyway, you got to check it because otherwise you don't know. And you go in there thinking, hey, this is just a little thing. And then you get that bill that you're asking me to translate. So one of the biggest things you want to do is know before you go. And if you just ask, what's my deductible? What's my co-insurance, and what's my maximum out of pocket, which means after all is said and done, everything, the maximum you're going to pay is that number. And you'll be surprised how fast you get there. But anyway, that's what I can give you, over the phone here. So thanks for listening to Health Talks, and we look forward to talking with you again next week. Your comments and questions really drive this show, and they actually help us improve understanding for all the listeners. Be sure to leave your comments at www.healora.com/health talks, and we're going to be sure to answer them. Check out the new episodes every Wednesday morning at 8 a.m. Pacific Time. This is Health Talks, powered by Healora.